Real quick introduction. Amy Hayes received her PhD in chemical biology from Ohio State University, and after her postdoctoral studies at Ohio State University, she taught organic chemistry as an adjunct faculty. Following her interest in public health, she joined the Ohio Healthy Homes and Lead Poisoning Prevention Program at the Ohio Department of Health. There she was the first public health lead investigator, then surveillance coordinator for the program. In 2016, she joined the Virginia Department of Health's Division of Environmental Epidemiology as a health assessor, and in that role, she evaluates the risk to human health caused by exposure to toxic substances in the environment. I'm trying to talk too fast, but very happy to have Amy here to talk to us about the public health implications of these oil spills. Thank you, Amy. Do I put this here? Or?
Sure. Okay, so first we've talked a little bit about the components of oil spills. It was mentioned earlier that oil spills all have a fingerprint, and that's because it's such a complicated mixture. Crude oil, if you look at crude oil, it's a mixture of long hydrocarbon chains that can be alkanes, alkynes, alkenes. This is whether they have double or single bonds or triple bonds. These can be branched chains as well as just linear ones, can be cyclic compounds. And the carbon chain length is a very wide range. You can start with a chain length of 1, which would just be methane, going all the way up to 40 carbon chains. And this is a range from a very low mass to very high mass. There are also aromatic compounds, benzene and toluene, and these are of note for a lot of them are carcinogens. And polycyclic aromatic, sorry, is that better? Okay. Polycyclic aromatic hydrocarbons, PAHs, which were mentioned earlier, which are also of note for their carcinogenic nature. Additionally, there can be metals and sulfur and nitrogen containing compounds, which when you hear somebody talk about sweet versus sour crude oil, it's talking about how much sulfur is in it. When we have crude oil and it's refined, what they're doing is actually taking out a lot of this stuff. So we're going to have a different composition. It's going to be focused on a certain chain length. So gasoline, Frank had a wonderful slide with pictures of beakers containing each of these. Gasoline is going to be the lower mass ones, then kerosene, diesel fuel, residual oils, which are going to be the very heavy black tarry liquid. So these also, beyond the chain lengths that they also have different aromatic compounds in them, different metals, and different sulfur and nitrogen containing compounds. So the significance Frank mentioned, the short chain ones like you might find in gasoline, these have high acute toxicity, but they also have high volatility. So they tend to evaporate out quickly if there's a spill. So they have low environmental persistence, long chains, lower acute toxicity, but they have low volatility and they stick around for sometimes years. So crude and residual oils are going to produce the dirtiest spills. When we have an oil spill, we also have dispersants. These were mentioned earlier, but I don't think we really went into any detail. These are surfactants. They have one end of it is going to be able to interact with water, one end interacts with oil. So what it does is it breaks up the surface tension, causes the oil to form tiny little droplets and disperse into the water column. So this not only gets rid of the slick that's on the surface, but it's also supposed to hasten biodegradation of the oil because there's more surface area for bacteria to eat the oil. They also have their own health effects, which I wanted to cover just real briefly here. So they're not generally particularly toxic to humans. They have similar toxicity to other surfactants and detergents, can cause burning nose, throat, or lungs. This is caused by the interaction with the mucous membranes. Tightness in your chest if you breathe this stuff, burning eyes. And these are also what we're going to see with some of the oil as well. So we have been spilling oil in various volumes for over a century now, but surprisingly, we don't actually have very many studies on the human health effects of oil spills. This is for a couple different reasons. It's hard, if there's a spill, it's hard to track down any small health effects unless you have a really large population to study. And in most cases, the people who are going to be directly exposed to a spill are the people who are doing the cleanup. And then the people that are living nearby are not going to have the same level of exposure. So these are some of the studies that I've looked at specifically. Deepwater Horizon is the big one. That's 210 million gallons of crude oil. That's pretty apocalyptic in terms of oil spills. The only thing bigger is the Persian Gulf during the war there. There was crude that was dumped into the ocean. I was reading, it said you could stand on the beach and look out at the ocean and the water would be black as far as you could see. So that was another very significant one. But Deepwater Horizon has the most studies done. Then there's Breyer and Prestige, were some other kind of more recent spills that were of significance for human health impact, but also for environmental impact. Exxon Valdez, this is one of the early ones that was studied, but actually there's not that much data that came out of it that is that useful. So it's kind of surprising considering that was not that long ago. Tasman Spirit, that was off the coast of Karachi. So that was one with a high population exposure. And then the Hebei Spirit, South Korea. And this is a kind of a smaller one, but this also affected some pristine beach. So it was had more attention paid to it than some other spills. So also, if you look at these are spilling crude oil. There's one, the Prestige was number 4 fuel oil. Generally, the big spills are going to be crude oil because a lot of these are tankers. So by comparison, I just did a Google search for oil spills Virginia, and I came up with these 4 examples. The first 3 pretty far back in time, spilling. The first one, number 6 fuel oil, so that's a heavy residual oil. Then diesel and gasoline for this barge. Those are going to be the lighter weight, so those are easier to clean up. And then one that spilled number 4 fuel oil. So probably most of the spills that we would see in Virginia are probably going to be these residual fuel oils. The other one that everybody's talking about today is the JP5 spill in Oceana. That's kind of an honorary mention here because it was just inland and it got into some creeks, but I don't think it actually made it to the ocean. And that was also 94,000 gallons of kerosene. And considering that we have so many naval bases here, it's likely that we could see something similar happening with either jet fuel or with the fuel oils. We don't have any offshore drilling right now, and there are no refineries active in Virginia. It was mentioned earlier that we do have some shipping of crude oil going on, but it's not that high a volume. This could change if the offshore is reopened for drilling. There's been discussion of that in recent years, but right now I think that's still up in the air. So that could become a hazard in future. So when you have exposure to the spill, it could be immediate or delayed exposure. Direct contact with petroleum products on water, shoreline, or direct contact with dispersants would be the most likely immediate exposure. And this would probably be with people who are doing the cleanup, so probably not residents nearby. We could also have delayed exposure, dietary exposure, or contact with deposits on the shorelines. And this is exposure that would be like more seen through the general population. So the health effects of direct exposure, we know this fairly well because we've looked at petroleum products in other contexts as well as in oil spills. In the short term, people have headaches and dizziness, nausea, vomiting, cough, respiratory distress, chest pain, eye, nose, and throat irritation, dermatitis, and dermal hypersensitivity reaction. And then, as we mentioned earlier, dispersants also cause some of these symptoms. And then also, I saw several times back pain was popping up, and this is probably not toxicity related, but if you look at this photograph of this man who is doing beach cleanup, not wearing very much in the way of PPE, so high risk for dermal exposure there. But there's going to be a lot of bending over as they're raking and sweeping the beaches and shoveling up stuff. And so musculoskeletal injuries are a possibility. And people have been injured and even killed in accidents during cleanup of oil spills. So in these large spills, there has been some follow-up studies of people who were directly exposed during cleanup. And the one thing that keeps on popping up both in studies of people who worked directly with the spill and also in just studies of general population is anxiety, depression, and PTSD symptoms. And this is probably not actually due to the toxicity of the petroleum products, but it seems to be associated with income loss, family disruption, fear of persistent contamination, and in cases of like native tribes, interference with traditional activities. And this was studied 4 to 16 months after the spill. And I believe some, even a couple of years later, showed some residual anxiety and depression symptoms. In the Prestige oil spill, which I think that was off the coast of France or Spain, there were respiratory symptoms that were found, and these were studied up to 6 years after the spill. This is mostly just respiratory symptoms like cough, sneezing, and but also when they did spirometry, so that like how well your lungs function, people who were exposed during the spill had lower expiratory volume. And that seemed to persist for quite a long time. This, yes?
You also include responders in that PTSD, or anybody doing that?
I don't recall seeing any studies specifically. Do you mean like the people who are doing the cleanup?
Yes.
Yes, that most of these studies focused on them. So this Prestige study did. The anxiety, depression, PTSD, some of that's been done with just general community as well, but most of the long-term studies are done with people who actually did the cleanup. So also in the long term, this was also for people who are doing the cleanup. The Breyer and Prestige spills, there were follow-up studies after those looking for genotoxicity. So this would be of significance because of possible increased risk of cancer. So they found that there was DNA damage that persisted, but the medical significance is unknown because they didn't do like any study to see cancer risks. Probably it would be hard to detect something like that just because the population is not going to be large enough to pick up small effects. And also that can take possibly, this is 2 to 7 years. It might take 10 or 20 years to develop cancer after an exposure. Endocrine effects also studied elevated prolactin and cortisol and altered lymphocyte ratios, which could have significance for immune function. But again, we don't know what the significance of those might be. So these were not consistent or well studied. Really, the Prestige and Breyer were the only two that looked at these effects. So it's hard to draw any conclusions from that. So we also have indirect exposure that is going to affect more people than just those who did the initial cleanup. We have contamination of seafood after a spill. So the petroleum components and dispersants go into the water and then can be picked up by fish and crustaceans and shellfish. So FDA and NOAA have authority to close federal fisheries, and this was done in Deepwater Horizon. The states have authority over their own territorial waters, and probably if there were to be a decision on closure, that would be in conjunction with FDA and probably multiple state agencies cooperating together. In the case of a visible oil sheen, that was what FDA and NOAA would use to trigger a recommendation to close the area, plus safety margin. So always with toxicity, they say the dose makes the poison. So how much is too much petroleum products to tolerate in seafood? So this question was studied in the Deepwater Horizon spill. They shut down the fisheries. I think some of them were closed for a year or more afterwards. And to reopen them, what they did was to calculate, this is a PHE, polycyclic aromatic hydrocarbon. Those are those very large aromatic, sometimes carcinogenic compounds that persist for a long time after a spill. So they looked at 13 of these in seafish or seafood. There were 7 of them that were carcinogens and 6 of them that had non-carcinogenic health effects. And the ones that were carcinogenic, they had this, what they call the representative 1-benzyl A-pyrene. And they chose that to look at the cancer risk. And so what they would do was say, well, we have this PHA that is half as carcinogenic as BAP. So we're going to take its concentration, multiply it by 1/2, and then add that to the BAP concentration. And that comes up with an effective concentration. So this is the same type of calculation that's done with looking at something like dioxins to come up with a toxicity estimate. So They did that for the carcinogenic risk, and then the non-cancer risks, they looked at the concentrations of 6 specific pHs. They had a 2-tier testing strategy, which was actually really interesting because the first step was just a sensory step. So they took seafood samples and they had some trained experts that would smell them and then taste test them. And they had to have 5 out of 7 people agree that there was no taste or smell of petroleum products or dispersants in it. And then if the samples passed that, then they would go on to an analytical method where they would first look for the PAHs using this fluorescence detection. Is there something there or not? And then if they did find a detection, they would use a more sensitive method to see what was that aromatic compound and identify it, and then they would get the concentration from that. And then they did the same kind of thing for the dispersant that was used to measure how much was there in the sample. So they had a limit that was based upon what I just talked about in the previous slide, the health effects. And when the samples would clear both of these tiers, then they could reopen that fishery. So this was done specifically for Deepwater Horizon. We don't have, as far as I'm aware, we don't have a method to do something like this in Virginia. I do know that there's the shellfish safety. We have our own division that handles that, and so they might have a plan for that already. I think we have some people here that were with that group, but otherwise I think we would have to work with federal agencies to come up with a method if there were a large spill that would impact fisheries to such an extent. So there are also post-cleanup exposures that could cause indirect health effects. So when we're talking about the heavy versus light, if you have something like gasoline, it evaporates quickly. It's probably not going to persist more than a few days. But if you have something like residual oil, heating oil, then that's going to persist for a long time. The oil will undergo a process that's called weathering, where the light stuff will evaporate out of it. It gets mixed up with water and sand. It can form tar balls and mats that can persist for a long time in the environment, possibly for years, can be repeatedly buried and uncovered. And so you can have a beach that's considered clean, and then you come back the next day and there might be more tar balls washed up. So if somebody does contact residual oil, they should wash their skin with soapy water or baby oil. But the incidental exposure from things like this are not considered to pose a significant health hazard. It could be that if somebody is particularly sensitive and they come in contact with this oil residual oil on a beach, then they could get a rash or dermatitis. But for most people, it's not going to pose a hazard. So in summary, if you have people who are immediately exposed to a spill, they're likely to have a variety of acute health effects, nose, eye, and throat irritation, possibly dermatitis. Long-term effects can include people in the general community just because of the stress of the event, and also from economic loss, which we're going to talk about that a lot later on today. Other long-term health effects can include respiratory symptoms, at least in a couple different studies. So that could be something that's understudied right now. And we need to look at more study to see if there are any genotoxic or endocrine effects and what the medical significance of those could be. Contaminated seafood can provide or can pose non-cancer or cancer health risks, so we might have to shut down fisheries temporarily. And then the oil can persist for years on beaches, but doesn't have any great health risk to human health, although it's probably not good for the animals that live there. So I've got a reference list. These 2 reviews at the top are very useful if anybody has particular interest in these, and then some specific spills. And then if you'd like to read more about the seafood testing, that's this reference here. So, and then I'm
We have time for maybe one question, if we've got one burning question.
Yeah.
It's more of a statement, or I would probably say half of the spills I work, there's always the issue of seafood contamination comes up in about half the spills I work. Addressing seafood contamination is a trickery slope or a dangerous slope. It's very easy, in general, it's very easy to put a closure in place, but very difficult to lift that closure or open it up. My advice is that the people who at the end of the day are going to be making the decision to reopen, or at least making the recommendation to reopen the fishery, they're the ones who make the decision at the beginning of the day or at the beginning of the discussion. Do not have two groups of people, one deciding to close it and another group deciding to open it. And if and when you do shut down a fishery, identify up front what the criteria are going to be for reopening it. All right? Whether it's just based on sheen or visible oiling or organoleptic testing or smell or lab testing. But before any fishery is shut down, whether it's the shellfish or finfish or whatever, make sure that you have the best people that you can involved in the decision to shut down that fishery, and know what your criteria are going to be for reopening that fishery. I've worked too many spills where one group shut it down and another group was responsible for opening it up, and we didn't have any pre-identified thresholds or criteria for what, reopening the fishery. And in some cases, the closure went on for much longer than it needed to be, and it all was because of we couldn't get our act together in terms of the decision makers.
I think the type of thing they do with Deepwater Horizon especially would have very significant costs included, like where you're going to get 7 sensory experts to smell and taste your seafood.
Well,
so.
Up in that Rhode Island spill where we had the lobsters, and then that Portland, Maine spill, we had organoleptic people from all over the world come in.
Yeah.
They were experts. They had nose experts. They came in, it was freaky. But anyway, it was very, so all I'm saying is that if you're contemplating shutting down a fishery, make sure you get the best people involved right from the get-go, and make sure those are the people that at the end of the day are going to be making the recommendation to open up the fishery, and you know what the criteria are that you're going to use to reopen the fishery when you make your decision to shut it down, if that makes sense.
Mm-hmm. Okay, so we want to make sure we have enough time so that, and if you have other questions, Amy's going to be here through lunch.